started with everyone. Thank you. So good morning. My name is Rayanne. I'm the Foundational Community Supports Program Administrator. So work with at the Healthcare Authority in the Division of Behavioral Health and Recovery, and oversee and kind of organize that program in conjunction with Wellpoint and our partners over at DSHS. So I'll be walking us through the presentation today. We have a handful of slides, and then my partner, Kimberly Castle, if you want to introduce yourself, Kimberly, will be helping us with chat today.
Good morning, everyone. Nice to see you. My name is Kimberly Castle, and I am the Foundational Community Supports Quality and Alignment Analyst here at the Healthcare Authority. Look forward to having this conversation with everyone.
Right on. So we'll just dig in. Today we'll go over a little bit of housekeeping, just about the recordings and transcripts, things like that. We'll navigate through the program and the funding requirements and any limitations, talk through the roles and responsibilities as we have kind of imagined to this current point, and then we'll navigate through next steps, and we have a good chunk of time for questions at the end. So just for housekeeping, like I said, Kimberly is managing our chat today. So please go ahead and put any of your questions in the chat. We'll hold them until the end of the presentation, but please feel free to put them in there early or as they come up. We're going to provide the presentation slides to you shortly after this in a follow-up email within the next couple of days, so you'll get the slides. This meeting, like I said, is also recorded, so you'll also go ahead and get the recording as soon as that's available, and sometimes that can take about 2 weeks, but we'll get that to you as well. Yep, covered that. We'll tackle your questions when we get there. So program review. In terms of health-related social needs and FCS, and kind of what is this thing that we're talking about that the Healthcare Authority has been allotted some dollars for. So health-related social needs, this is part of the Medicaid Transformation Project, or part of the 1115 waiver. So you might be familiar that Foundational Community Supports is part of that. There's a couple of other initiatives around reentry, around respite care. This is another one of those that came out in what we would call 2.0 or MTP 2.0, have some additional dollars and some additional allowances that the state is able to offer to some of the Medicaid eligible folks. So these specific funds are intended to help support non-medical services, right? They're evidence-based, but they're for non-medical services that directly address a participant's kind of social conditions that lead to poor health. So very similar to the social determinants of health, you might be familiar with that language. The health-related social needs is a little bit drilled down more specifically. So what do they need in their environment or in their space that they're missing that's contributing to their poor health outcomes? So for a lot of folks, right, that's housing. Housing is a pretty big indicator about your health level or your access to different services. There's some other categories that you might see if you send a Google or check out the HCA website. There's some additional ones. So you might hear things about nutrition supports, maybe care respite services. Those are all additional kind of categories. And we have some contacts for you at the end of the slides that has some follow-up information if you're curious about those. But we're going to be talking about 2 of the overall categories within the whole chunk, and everything is kind of referred to as the health-related social needs, or HRSN. So it's the bigger category, lots of different options, and we're talking about 2 of those options today, or referring to them. So one of the options is the housing transition services. This is something that's already mid-implementation. We are looking to align this program, or this kind of chunk of dollars, with our current transition assistance program with TAP. And so it basically expands the services that we've been currently providing: first month's rent, maybe deposit, application assistance. Our current fund is state funded, and so this allows us to leverage some Medicaid dollars to expand those funds to folks across the state who are enrolled in FCS. So that's one of the chunks of funds. They get confused often with rental assistance, so that's why we're bringing them up together to kind of call them out, to hopefully help with the clarification. So it adds to our current kind of bucket of things that we can offer to enrollees, and we're estimated to launch in the next couple of months. We're hoping for the next month or so, but our goal is before July 1 or sometime this spring. So those dollars will pay for the kind of utilities, applications, things like that. And then the set of funds that we're talking about today that are specifically available to the public housing authorities, if you're interested, is rental assistance. So these rental assistance dollars are part of the overall HRSN, one of the categories. And it's up to 6 months of rental assistance per the demonstration period. And so our demonstration period ends in 2028. So it would be 6 months of rental assistance from now to 2028. They're payments made to independent living situations. So someone's transitioning, they need their first month's rent paid, but they're into things like an individual lease, maybe a mobile home, maybe a single room occupancy, something that's a relatively independent living situation. These funds, of course, will be managed by the HCA and by our contractor, the Public Housing Authority. And our goal is to work with the Public Housing Authority to launch in July of 2025 of this year, and have these resources be available to folks throughout the state. So in terms of these two buckets, they're operated separately, but they're going to be kind of in conjunction, and the intake point for participants is the same across the board. I'm trying to make these funds as easy and kind of simple as possible. Since they're new to us, new to the state, new to the public housing authorities, we want to try to have a really strong foundation and then kind of build up and imagine where we could go from there. So in terms of eligible population, so HRSN is that overall category, and can be implemented a couple of different ways. The healthcare authority for these specific funds has opted to target FCS enrollees, or foundational community support enrollees. So folks who are already receiving some sort of additional housing or employment support, so they've got care connected to them to help them kind of guide through the process. They meet the other required eligibility pieces. But really narrowing the eligibility just in full transparency helps us kind of manage the budget and what this might look like, the inflow, and make sure that we have really one kind of solid process or pathway for all the parties or all our contractors combined, so that we can, of course, implement it in the best way possible, and then dream big about what the next years could hold. So like I said, there's a wide scope of services under these funds. You might see things like, well, I see that rental assistance could cover utilities. That is something, but we're really rolling out just with rental assistance. We're just going to pay with this pocket of funds. We're going to pay short-term rental assistance or rental subsidies for FCS enrollees. And again, just a reminder, it's that 6-month total duration. So the fun stuff, the funding opportunities. This short-term funding overall for this next contract year is about $16 million. So if we contract with 2 public housing authorities, that $16 million would be split. If we go with 1, it would be 1 public housing authority to manage kind of across the whole state. And it includes a 10% administrative cost. So again, if we had 2 public housing authorities, each public housing authority would get the 10% admin cost in order to provide these funds to folks. Options to contract for additional years are incredibly likely. We have these funds awarded to us for the next couple of years through the demonstration period. So our hope is to do this first year kind of as a more so in the spirit of a pilot, but really trying to get our foundation down and then look at what the next years can hold. We have estimated about 2,000 to 4,000 participants throughout the fiscal year. You'll see in just a minute about kind of the maximum rent amount we can pay. And so trying to estimate based on different counties and the utilization, that's kind of where we think we're at, but it's really, again, new to us, and we'll be new, and we'll be watching and trying to monitor what that flow looks like. So the subsidy amounts will be determined by Wellpoint. So Wellpoint is the foundational community supports third-party administrator. Excuse me. They will determine the rental amount. They'll also do eligibility, which we'll talk about in a second. And they will say, these folks have requested rental assistance, HCA, are they good to go? The healthcare authority will verify that eligibility. We'll make sure that they're in line with that 6-month kind of rental period, making sure that they haven't, received too many months or have received 7 months or something. And then those folks, HCA will identify and send the public housing authorities a list of those folks and the information needed to be able to pay on their behalf. So within that, our contract is currently cost reimbursement. So that would mean that the housing authority pays out the dollars, submits an invoice to the healthcare authority, and then we would reimburse you for that. There is some exploration, and we'll talk about it a little bit at the end too, around being able to provide these funds up front and have the public housing authority manage them and do some different check-ins. But right now, we currently are approved for cost reimbursement. So want to make sure that anybody who applies for these, that's something that can kind of be handled or is within your capacity. And then at any point, whether we lump sum up front or it's invoices, if at any point you have extra funds, those have to be returned to the healthcare authority within 30 days. So those would be identified and we would work with you to make sure those get back to the healthcare authority. So roles and responsibilities, this is probably the part that has the most interest in how will this work and what do each of the groups do. So as you can see on the left, the enrollee will request rental assistance through the FCS portal. So that's directly through with Wellpoint through that transition assistance portal. They'll request, provide the verification, the documents needed, proof of inspection, things like that that are required for these funding or for these dollars. Wellpoint's going to collect, they're going to review, and they're going to initially approve any of these funding requests. So they'll go ahead and look and verify eligibility, say, yep, this person looks good, and they'll pass that information over to the healthcare authority. Like I said before, the healthcare authority will double check because these are Medicaid funds and new, and so we want to make sure that we're doing all the right things. So we will review eligibility and we'll approve payment. When that happens, the healthcare authority will tell the public housing authority, hey, this group of 100 folks are eligible for payment. Here's the payment amounts. Here's the information for that payment. And we would provide that to you. The public housing authority here in blue, you would receive that list and you would pay that rental assistance. At this point, you would then submit to us verification that you paid those rents. So saying, yep, those were paid to the folks that you identified for us. You would submit a monthly invoice to the healthcare authority and we would help process that as quickly as possible. We've got some steps in place to make sure that happens quickly. And then HCA would reimburse the public housing authority for payments. So this process would kind of go over and over again, and we would work with you on what the best kind of processes are, systems, and way to share that information with each other. So kind of navigate through that process. It starts with Wellpoint, goes to HCA, and then goes to the public housing authority. So there's parts in here where Wellpoint will play a role and parts where the public housing authority will play a role, but not often will those two connect directly in terms of discussing participants, things like that. All of those conversations will happen with the healthcare authority and the public housing authority. So just some kind of outstanding decisions, because I'm sure these will come up in questions. We have now still currently working to identify what the frequency of report sharing or back and forth with the public housing authority is. We want to work with you to see what's realistic, what days make sense, but we know that we need folks to get their rent paid quickly. So we know that it has to happen on some sort of kind of predictable basis. We have some decisions in the long run around additional payment categories and that lump sum payment. That's what I talked about if we can provide those dollars to the public housing authority up front, that's our goal. But right now we're cost reimbursement, so we're still exploring that. We have outstanding decisions based on who applies about choosing one or two. We'd like to not go over two public housing authorities to cover the state. And then still deciding what information is specifically required for payment. So those data elements for sharing. So what exactly does the public housing authority need in terms of data elements in order to be able to pay on someone's behalf? So we still have those to figure out that we want to work with whoever's chosen or awarded these funds to kind of identify and work out the best processes together. Some considerations is that the contract specifically will include language around payments and verifying funds and data sharing. It'll be all really specific in there. And when we get to the contracting process, we'll have a contract specialist who can help navigate through some of those questions around payments, or what happens if it's a lump sum. What does that mean? They'll be able to help us there. No enrollees, this is a question that's come up from a couple of folks. No enrollees have been identified in terms of FCS or placed in a queue at this time. So there's not folks like waiting with all of their ducks in a row waiting for payments. We're really rolling this program out and at the early stages of that. All payments will be made to the property owners or the managers. It will not be made to the participants themselves. So this is on behalf of the participants and will be made based on what their lease identifies. So if it's a property management company to them, if it's the owner directly to the owner, we'll follow what the lease guidance says, but never will a payment go to a participant. And then we'll have at least at minimum bi-monthly meetings with the Healthcare Authority, potentially Wellpoint, and the selected public housing authorities, just for frequent check-ins, what's going on, how's it working, and to kind of reorganize anything that we need to do. In part of this, we also talked about being in partnership with ALTA, with DSHS, and so there likely will be some meetings too to make sure that we're all doing the processes as simple as possible. So there will be a couple of meetings that you'll be asked to attend or participate in. And then the bigger chunk of the responsibilities comes with getting those funds out to those landlords or managers. So next steps for us, we have an additional listening session in addition to today's. So we kind of hang out until the 19th where there's interest. We need the interested public housing authorities to respond to the questions that are listed in the letter of interest. I also have them on the slides a little bit later in case you need the refresher, but we want the public housing authorities to respond with those questions and let us know how this might work for you or what's within your capacity, anything that you might see outstanding that needs to be addressed for these funds to be successful. And then early April, the Healthcare Authority will announce the 1 or 2 public housing authorities that have been selected to help us roll out these funds for individuals. And then our goal is to start contracting the contracting process immediately once announced, and then be ready to implement. So be planning in this meantime and be ready to implement a July 1 rollout or launch where these funds are available to participants. So these are the letter of intent questions, just so you have them up there, but we want to know things about your cost reimbursement. Can you do that? Is that something that's reasonable or realistic for your size of public housing authority? What coverage area do you have? Do you already have kind of agreements with across the state, or do you cover certain areas or maybe half the state? We need to know kind of what that scope looks like. And then, of course, anything specific to you that might be needed for the Healthcare Authority to know in order to prepare for the launch. So something that might be unique to you or unique to your housing authority that will help or hinder or might be a limitation, right? Or might be a benefit for rolling out these funds. And then, of course, just the listening session link, and we attach the dates and details of the things as they come up. For your awareness, same things we've all, I've said a couple of times now, but with the goal of being July 1. And then questions, if you have in-depth questions outside of this space, or you want to talk through what this might be, or questions around HRSN, please reach out to Kimberly or myself via email. We'd be happy to chat with you. And wanted to highlight that if you have questions about those other categories that I talked about, so the nutrition supports or the respite care, you'll want to email Matt Christie, or of course you can reach out to us and we'll get you connected to him. But he's overseeing all of those kind of funds and the implementation for those, and can follow up on specific questions about those other categories. Other than that, Kimberly and I are happy to take questions and conversation and really dive into what this might look like for all parties. Okay, we went through that super quick. Pretty efficient, I think, for this morning. So we're open for questions. What kind of questions or curiosities are present? And Kimberly, if there's any questions in the chat, happy to tackle those with you.
No questions so far in the chat.
Awesome. Okay. Any questions from the group?
I have a question.
Yeah.
Looking at your process slide, you're showing that the healthcare authority will be the entity to submit to the housing authority the payment list.
Correct.
Is that the only form of communication of payments? Is going to be coming from a one source? It's going to be one-to-one?
Correct.
Okay. I have another question if no one else wants to jump in. So will the housing authority be required to issue the 1099 to the owners of these payments that are being issued?
That's a great question. We've been having that conversation. I think the answer is yes, but I can confirm.
So the part B to that would be then is the process of providing the documentation for those owners for purposes of verifying would be worked out as this is established.
Yep,
Okay.
absolutely. Yep.
So there would probably be a bit of a lag. It couldn't be simultaneous if a payment request and we don't have an owner set up in our system or verified through IRS 10 matching. That kind of stuff would probably have to be front loaded before payment requests get submitted, or there'd be a delay in those particular payments while that is done.
Okay.
Just to be considered in the process.
No, thank you. Thank you.
How soon, it's quiet, so I'm just going to keep on rattling along.
Okay.
How soon after A19 is submitted could a housing authority expect a reimbursement? Because I imagine if you have 2,000 to 4,000 participants, this could turn into a pretty chunk of change every month to be front loading. So if there's a quick turnaround, it may not be as problematic as, a 3-week turnaround.
Yeah, absolutely. So we're having lots of discussion with our accounting team to make that process as quick as possible. So there's intention to do that kind of faster or more expeditious than our traditional process because it would be such a big amount. So we'd work out that with you and what that looks like. But it would be faster than kind of the traditional HCA timeframe, which is 30 days. Our goal would be somewhere around that kind of 7 to 10 range, but don't have that like locked and confirmed just yet. Great question.
I have a question.
Yeah, go ahead.
So in this process flow, with the whoever's approving, is the HCA approving that? So would they be approving like for every recipient 6 months, or would there be a varying amount of months depending on the request? How much variance would there be in the duration of the subsidy payments?
Great question. So they can also be used for back payments. So it could be multiple payments together. So it could be January, February, and March. It wouldn't be, at least right now, we're not looking at saying March through the next 6 months. Each month they would be added as a new month of coverage. So each time you get the list, that would be an individual payment for that person. So if they needed 3 months of rent moving forward, they would be on the list for March and April and May. It could be multiple months, like I said, in arrears. And that's specifically what the Healthcare Authority and Wellpoint are tracking, is how many months of those things is received. So it could be different for each person, but our hope is to provide the information to you in a very standardized, clear way so that you know exactly what months, what things are covering. Yeah, for tracking.
Makes sense. Thanks.
Yeah, great question. Well, next steps from here we'll process the recording. We'll identify all the questions and make sure that we provide those some answers to those questions in writing, just so that you have them as well. And then we'll wait for the next one and hope to see you if you have more questions. If you don't, feel free to send in any of your questions to Kimberly or I. And then, of course, please submit that letter of intent anytime you'd like. We just need it before the end of March. So that's really our cutoff for that. So if you know that you're interested in this, you feel confident that you can move forward, please feel free to send it now. If not, please attend the next listening session and we'll make sure to try to address any of those other questions or concerns at that time. Okay. We scheduled so much time.
Sounds good. Thank you.
Thanks for coming today. We appreciate it.
Thank you.
You're welcome.
Thank you. Thank you. Please reach out.
Okay, will do. Thanks.
Take care, everyone.